It's often said that our health is our greatest wealth, a truth that has become painfully clear in the district of Hassan, Karnataka. A deeply concerning pattern has emerged here, one that has left families grieving and communities searching for answers. Over the past 40 days, this region has witnessed a frightening spike in deaths from heart attacks, with a staggering 21 lives lost. This isn't just a statistic. It represents mothers, fathers, professionals, and farmers whose lives were cut tragically short. The suddenness of this wave of fatalities has created a sense of unease and urgency, prompting everyone from local residents to top government officials to ask the same pressing question: what is happening to the hearts of Hassan? What makes this situation even more alarming is the age of those affected. When we think of heart attacks, we often picture older individuals with long-standing health issues. However, the reality in Hassan paints a very different picture. Of the 21 recent deaths, a shocking number of victims were young adults. 5 were between the ages of 19 and 25, and another 8 were in the 25 to 45 age bracket. These are individuals in the prime of their lives, many of whom had no known history of heart disease. The stories are heartbreaking. A 58-year-old professor who collapsed at his college, a 53-year-old farmer who passed away after being hospitalized with chest pain, and even a young army officer on leave. The recent incidents are part of a larger, more disturbing trend that has been quietly growing over the past 2 years. During this period, the district has recorded over 500 heart attack cases and nearly 200 deaths, with a significant proportion impacting younger people. These are not isolated events, but part of a wider public health crisis that demands our immediate attention. The fact that many of these fatal events occurred at home, often without warning, highlights a critical gap in awareness and access to emergency care. It's a silent epidemic that has now become too loud to ignore, forcing a community to confront an invisible threat. The impact of this crisis extends beyond the immediate families and into the very fabric of the community. The stories of these sudden deaths have spread rapidly, creating a palpable sense of anxiety among the public. People are worried, and rightly so. They see their neighbors, friends, and colleagues, many of them young and seemingly healthy, falling victim to this condition. This fear has led to an increase in people seeking medical advice, with hospitals like Jayadeva in Bengaluru reporting a noticeable rise in patients visiting their cardiac departments. This collective concern is a clear signal that people need reliable information, reassurance, and clear guidance on how to protect themselves and their loved ones. As investigators and health experts dig deeper into this crisis, they are exploring a complex web of potential causes. There is no single simple answer. Instead, it appears that a combination of factors is likely at play. A major area of focus is our modern lifestyle, which has changed dramatically over the last few decades. Experts are pointing towards the widespread adoption of unhealthy habits, including poor dietary choices rich in processed foods, fats, and sugars. This is often coupled with a sedentary lifestyle, where physical activity has been replaced by long hours spent sitting, whether at a desk for work or at home engrossed in digital devices. This lack of movement is a known enemy of heart health. Another significant piece of the puzzle is the rising prevalence of chronic health conditions, even among younger people. Conditions that were once considered diseases of old age, such as high blood pressure, hypertension, and type 2 diabetes, are now increasingly common in young adults. These conditions are silent risk factors for heart disease, often developing without obvious symptoms until it is too late. The stress of modern life, from financial pressures to work demands, also plays a crucial role. Chronic stress can lead to high blood pressure and encourage unhealthy coping mechanisms, further straining the cardiovascular system and making it more vulnerable. The investigation is also considering environmental influences. The quality of the air we breathe and the water we drink can have a profound impact on our overall health, including our hearts. Experts are examining whether local pollution levels or contaminants in the food and water supply could be contributing to increased cardiovascular risk in the Hassan region. Furthermore, some medical professionals from the Hassan Institute of Medical Sciences have raised the possibility of a genetic component. They are exploring whether there might be a genetic predisposition in the local population that affects the heart muscle, making individuals more susceptible to cardiac events. it is incredibly important to address a common concern that has surfaced amidst this uncertainty: the role of COVID-19 vaccines. Health officials and experts involved in the investigation have been very clear and firm on this point. Based on all the data and evidence reviewed so far, there is no scientific proof linking these tragic heart attack deaths to the COVID-19 vaccinations. While the post-pandemic health landscape is complex, the focus of the investigation remains squarely on the more established and evidence-based risk factors, such as lifestyle, pre-existing diseases, and environmental triggers, rather than unsubstantiated claims about vaccines. In response to this growing public health emergency, the government has moved swiftly to take action. Recognizing the gravity of the situation, Karnataka's Chief Minister, Siddaramaiah, has personally ordered a high-level inquiry to get to the bottom of this tragic trend. This isn't just a routine procedure. It is a signal that the state's highest authorities are treating this matter with the seriousness it deserves. The goal is to conduct a thorough and transparent investigation that can provide clear answers to the concerned public and guide future health policies to prevent more lives from being lost in this devastating manner. A dedicated committee of experts has been tasked with leading this crucial investigation. This team, led by senior health officials and prominent cardiologists from institutions like the Jayadeva Institute of Cardiovascular Sciences and Research, is meticulously examining every detail of the recent cases. Their work involves a deep dive into the medical records of each victim, looking for common patterns, underlying health conditions, and potential triggers. The committee is expected to deliver its findings within a very short time frame, reflecting the urgency of the situation. This rapid, expert-led approach is designed to replace speculation with facts and provide a solid foundation for an effective response. The initial findings from the investigation have already provided some valuable insights. After reviewing 18 of the recent deaths, the committee noted that half of the victims were over the age of 55 and had existing comorbidities like diabetes or hypertension. This reinforces the well-known link between chronic disease and heart attacks. However, the data also confirmed the worrying trend among the youth, with some of the younger victims having undiagnosed or poorly managed conditions like type 1 diabetes. Crucially, the review found that 16 of the 18 deaths occurred at home, highlighting a critical need for greater public awareness of heart attack symptoms and the importance of seeking immediate medical help. Alongside the formal investigation, health authorities are actively working to strengthen the local healthcare response. Taluk-level health officers across Hassan district have been given clear instructions to be on high alert and to respond immediately to any reported cases of chest pain or other potential heart attack symptoms. The government is also launching a public awareness campaign, urging citizens to not ignore warning signs and to prioritize their health. The message is simple but powerful. Get regular health checkups, understand your personal risk factors, and do not hesitate to seek medical attention if you feel something is wrong. This proactive stance aims to save lives by promoting early detection and intervention. While experts and officials work to understand the bigger picture in Hassan, there are practical, empowering steps that every single one of us can take to protect our own heart health. The power to build a healthier future truly lies in our daily choices. The first and most important step is to embrace a heart-healthy diet. This doesn't have to be complicated. Focus on eating more whole foods, fruits, vegetables, whole grains, and lean proteins. Try to reduce your intake of processed foods, sugary drinks, and unhealthy fats. Small, consistent changes, like swapping a packet of crisps for an apple or drinking more water, can make a huge difference over time. Next, it is absolutely essential to get your body moving. Our bodies were designed for activity, not for sitting for hours on end. Aim for at least 30 minutes of moderate exercise like brisk walking, cycling, or swimming most days of the week. You don't need a fancy gym membership. A simple walk in your local park is a fantastic start. Regular physical activity helps control your weight, lower your blood pressure, and strengthen your heart muscle. It's also a wonderful way to manage stress, which is another critical factor in heart health. Find an activity you enjoy, as that will make it much easier to stick with it long term. Understanding your numbers is another vital part of taking control of your heart health. This means getting regular health checkups to monitor key indicators like your blood pressure, cholesterol levels, and blood sugar. Many of the risk factors for heart disease are silent, meaning you won't know you have them without getting tested. Knowing your numbers allows you and your doctor to take proactive steps if any of them are too high. Don't wait for symptoms to appear. Be proactive and make an appointment for a basic health screening today. It is one of the most important investments you can make in your long-term well-being. Finally, you must learn to recognize the warning signs of a heart attack and know what to do. Symptoms can include discomfort in the center of the chest that lasts for more than a few minutes, pain spreading to the shoulders, neck, or arms, shortness of breath, and feeling lightheaded or nauseous. These signs can be different for men and women. If you or someone you are with experiences these symptoms, it is critical to seek emergency medical help immediately. Do not delay. Every minute counts when it comes to saving heart muscle and ultimately saving a life. Your awareness and quick action could make all the difference.